The first procedure we're going to discuss is the Roux-en-Y gastric bypass. This surgery has been around the longest of all the surgeries that we're going to talk about. Many of you are probably familiar with it because of that. And by far we have the most data in reference to Roux-en-Y gastric bypass. This is a combination procedure. It combines restriction with malabsorption. And so therefore you'll have two modalities that will help you lose weight. There are four basic ways that this procedure works for you. Appetite suppression, meaning you're not going to be as hungry as you were before. Patients will state that they notice this anywhere from 6 months up to a year and a half after surgery. Restriction, you're going to get full sooner, which will help you lose weight. Malabsorption. Malabsorption means that the amount of calories that you take in, you're only going to absorb a portion of them, which will ultimately help you lose weight. The fourth factor that I'll mention, I want to talk a little bit more about than the other three, and that's something called dumping syndrome. Dumping syndrome is a phenomenon that occurs when your anatomy has been altered in a specific way and you eat high sugar content foods. Dumping syndrome does not just occur in a Roux-en-Y gastric bypass. There are other procedures that we do in the general surgery world that have a Roux-en-Y as part of the procedure. If that patient who has had a Roux-en-Y eats high sugar content foods, they may develop dumping syndrome, which may make you feel very ill. It may make you feel lightheaded. It may make you feel nauseated. You may experience diarrhea. And some people like to refer to dumping syndrome as one of the ways that a gastric bypass works for you. I'll let you decide for yourself if you think that that's a good thing or a bad thing. I personally don't think that that's something that you want to depend upon to help you lose weight. Because let's think about it. If you're experiencing dumping syndrome, then we're probably not following the rules that we've talked to you about in your initial education to be successful. However, there are some patients that like the fact that they get some negative feedback when they make a bad decision and eat a wrong food choice. Throughout the presentation, you'll see dumping syndrome referred to as a positive or a negative. I'll let you decide which category it fits in. Take a look at this video, which will show you the basics of how a Roux-en-Y gastric bypass is performed.
This educational video will explain the normal process of digestion, the Roux-en-Y gastric bypass procedure, and how weight loss will occur upon completion of the surgery. Currently, your stomach can hold about 40 ounces of food. Once in your stomach, the food combines with digestive juices containing acids and enzymes that help break it down into smaller particles. Once broken down, the small particles are slowly released into the first part of your small intestine, the duodenum, by a muscle called the pyloric valve. The pyloric valve is a ring of muscle between your stomach and your duodenum. Most of the nutrients from the broken down food are absorbed in the duodenum and the jejunum, which is the second part of the small intestine. The steps in the Roux-en-Y gastric bypass involve dividing your stomach into two sections to create a smaller stomach pouch, dividing your jejunum into two sections, creating a Y connection between both parts of your jejunum, and creating a connection between your stomach pouch and jejunum. Your surgeon starts by using an endoscopic stapler and divides your current stomach about 1 to 2 inches below the area where your esophagus connects to your stomach. The smaller upper section of the stomach that is connected to the esophagus is your new stomach, also known as the gastric pouch. This gastric pouch will hold about 2 ounces of food. Next, your surgeon divides and seals your jejunum into two sections. Your surgeon will take the shorter part of your jejunum and reconnect it to the longer part of your jejunum at a point further below the point of division. Next, the remaining part of your jejunum is pulled up and attached to your gastric pouch. Food will now go from your new stomach pouch directly into your jejunum. Prior to surgery, food went from your stomach into your duodenum. Your duodenum and a small part of your jejunum are now bypassed, and will not come into contact with any food. Because food bypasses the duodenum and part of the jejunum, fewer calories are absorbed.
Let's look at the advantages and disadvantages of a Roux-en-Y gastric bypass. The advantages: rapid weight loss. You'll see weight loss occur probably the fastest with this procedure compared to the others. Not by much, but it typically will be the fastest weight loss that you'll see. Appetite reduction and restriction. We've explained why that occurs, and you will experience both with this. Malabsorption and dumping. As I mentioned before, you're going to see this listed as an advantage or a disadvantage. I'll let you decide how it works for you. The potential impact on diabetes. We've known over the last few years through new research and data that type 2 diabetes can be positively impacted with surgical weight loss options, and Roux-en-Y gastric bypass is one of them. In fact, there's literature that shows that when you compare medical therapy to a Roux-en-Y gastric bypass, and as later we'll mention, a sleeve gastrectomy, type 2 diabetes responds better to surgical weight loss options as opposed to medical therapy. And in fact, many people are cured of that disease. Lastly, there's no foreign body or no adjustments required, meaning nothing's going to be inside of you that didn't start there. So what are the disadvantages? Roux-en-Y gastric bypass is the most complex surgery that we perform. Now, in my opinion, in experienced hands and bariatric surgeons who do a high volume of bariatric surgery, the risks are pretty close amongst all these. But there's no doubt that there are more risks with the Roux-en-Y gastric bypass compared to the others. Some of those are obviously leaks. Anytime you take a part of the intestines apart and put it back together, there's always a chance of a leak. And that's one of the big risks that we all watch for and worry about in a gastric bypass. You must avoid tobacco, non-steroidal anti-inflammatories, and certain other medications if you have a Roux-en-Y gastric bypass. Not just around surgery time, but for life. You'll hear us in our program talk about tobacco specifically, and we're going to want you to stop no matter what. We do that because you're making a decision for your health, and we want to make sure all factors are helping augment your health for the rest of your life. But specifically for gastric bypass, tobacco and other medications can cause problems with ulcers because of the change that we've created in your anatomy. So for the rest of your life, you cannot go back to tobacco products, non-steroidal anti-inflammatories, or certain other medications like steroids. And if you have a medical condition that requires some of those medications, Roux-en-Y gastric bypass is not an option for you. You're going to need to take lifelong vitamin supplementation and protein supplements. Like I mentioned before, we create malabsorption to help you lose weight. But there's a downside to malabsorption, and that means that the things that you take in, you won't absorb 100%. So we have to supersede that, and we have to make sure that you're taking appropriate supplementation to overcome that malabsorption that we created, which helps you lose weight. I mentioned there's an increased risk of ulcers because of some of those medications, and sometimes even if you don't take those medications or use tobacco, you can still develop an ulcer in your gastric pouch. So this will be something that we'll have to watch for the rest of your life. Lastly, you will have an increased risk of a bowel obstruction if you have a gastric bypass versus some of the other surgeries. Bowel obstructions occur typically due to adhesions, which can occur in any surgery. But in specifically a gastric bypass, because of the change we create in your anatomy, there's some other risk factors that occur that can make you more prone to a bowel obstruction. And that's another thing we'll have to watch for as well.